Hello, my name is Gabriel Elul and I welcome you to another video show by TheSynapse, bringing content that matters to the busy medical professional. We have with us today Dr. Michael Borg, a consultant in infection control. Welcome, doctor. We are going to be speaking about Ebola today and the risk of acquiring Ebola in Malta and how to diagnose it as a busy medical professional. So basically, doctor, what is the risk of acquiring Ebola here in Malta in comparison with other countries, namely those of West Africa?
The risk is extremely low for the very simple reason that as we stand today, the countries where Ebola is present, namely Sierra Leone, Guinea and Liberia, are countries where human traffic to Malta, in the sense of flights, in the sense even of regular migrants, are primarily quite low.
So, that being said, provided that as a doctor or as a healthcare professional, we might encounter a person who potentially has Ebola, how would we be able to diagnose it?
Yes, of course. So the diagnosis of Ebola depends on a positive case definition. And the positive case definition is very simple. It basically requires three things. First of all, travel to one of these three countries. Once again, as I said, they are primarily Guinea, Liberia and Sierra Leone. There is also at the moment a small outbreak in the Congo, but it's very rural, it's very restricted, and it doesn't seem to be affecting the Western world. But Sierra Leone, Liberia and Guinea are key important areas. So this has to be the first point. Has the patient been in these countries? The second point is that it has to have happened within the past 21 days. Why? Because that is the incubation period of Ebola. So you have to have a patient who has been in one of these three countries in the past 21 days and, very importantly, has symptoms. And the primary symptom of Ebola is fever. Now, up till some weeks ago, we used to say the fever should be around 38.6, but what we are seeing, especially with these cases in Europe, is that sometimes at the very beginning, the fever is less than 38.6. So if you have a patient with fever and who has been in these three countries in the past 21 days, that constitutes a positive case definition.
And what can you comment about the fact that recently we had a number of suspected cases which all turned out, fortunately, to be malaria? What tip can you give to the medical professional?
I mean, first of all, even today, with this well publicized and well studied major outbreak in these three countries, malaria is still the most common reason for fever in a returning traveler from Africa, including any of these three countries. So obviously, this is the first and primary differential diagnosis. But obviously, until you exclude Ebola by testing, it has to also form part of the potential reason for this fever. And as a result, this patient must be regarded as Ebola until the case or the test is negative.
So let's put ourselves in a scenario. Imagine I'm a doctor and in my clinic I have this patient whom I suspect has Ebola. What should I do?
So first of all, I mean, again, this is at least judging by what has happened in other countries. It is not likely to be a major scenario. Most of these patients have actually gone to emergency and admitting departments. So that is, again, part of the whole picture. But you can never say never. So this can happen. So in this case, it is very important. I think it's always important for any doctor, including general practitioners and family doctors, to make sure that they include a travel history in their management of every patient. I think what Ebola has shown us is that we probably need to upgrade, to tweak, to improve our management of patients, especially patients presenting with fever. And one of the things that we have to always ask for any patient who comes to our clinic with fever, one of the first questions you ask is, have you traveled recently? So obviously, if you have a patient who has traveled recently to these three countries, and you establish that this has happened in the past 21 days, then you have to undertake a number of measures to manage that patient.
And if I have, unfortunately, Ebola here in Malta, what is my prognosis, and what is the chances of treatment which I will receive here?
I mean, let's put things into perspective. The likelihood of getting Ebola
It's very, very
should
low.
be extremely low. So what we are seeing, for example, even with these cases that unfortunately have happened in America, in Dallas, in Spain, in Madrid, where healthcare workers have become infected from patients they have treated, has shown us two things. First of all, that the contacts of these patients, thankfully, were all negative. In other words, even people who had lived with these nurses, in the same household, the husband of the Spanish nursing aide, for example, thankfully has been determined to be negative. And of the reason being it's not as transmissible as some people actually think it is. So you need to have direct contact with blood, direct contact with body fluids. It's not spread by air. Okay? In the general term that we regard in terms of airborne transmission, it is not spread by air. It can be spread by droplet, just like influenza. It can be spread by droplet, but it is not an airborne transmission. So that's the first point. The second point is, as we're seeing from these cases, thankfully they seem to be recovering quite well. So although we look at the situation in Africa and see that you have between 50 to 70% mortality in Sierra Leone, in Liberia, in Guinea, of course the medical services and the medical infrastructure in these countries is extremely primitive, unfortunately, because of the economics of these countries. So you cannot compare it to what we would be able to provide here in Malta or anywhere in Europe. And what you do is actually provide supportive care. There is at the moment a number of investigational or trial treatments. We've heard about ZMapp, we've heard about ZMapp, which is the precursor of ZMapp. These are monoclonal antibodies. One of the most favored therapies for the recent cases have been using convalescent serum from patients who had recovered from Ebola. So there are a number of supportive therapies. But the most important thing is to ensure hydration. So these patients get, or we ensure in the hospital setting that they have an effective fluid and electrolyte balance, which is the key to treatment.
And going off at a tangent here, you mentioned that the risk of acquiring it is fortunately very, very low here in Malta. But regardless, many medical professionals are faced with constant questions by patients who visit their clinics and who are, in a way, afraid of acquiring this disease. What advice, what tips should these medical professionals give to their own patients who are concerned?
Basically, I think it's the most important thing is to reassure these patients. Unfortunately, patients will not uncommonly see these rather dramatic scenes on TV. They will see these documentaries which are very factual and very correct, from Africa, and they make one and one and come out with 21. And of course, we have to really make it clear to these people that you have to have travel to these countries. So it's not something that anyone in Malta is likely to encounter. It is only outside of Africa, it is only in healthcare facilities, primarily in hospitals, treating patients who have come from Africa, from these three countries, such as we saw in Spain, such as we saw in America, where there were patients who had initially gotten infected in these countries, were brought to Europe, and unfortunately there was a cross-transmission. That's something that you obviously have to manage.
Thank you, Doctor. Just to make it clear to the audience who is following us here, if I have a positive case definition, what should I do?
So, there are two things. First of all, the most important thing is that we get into the habit of adopting good infection control practices, which is obviously something that I continuously moan about and groan about, but it is very important. Because once you have exposure, that exposure is likely to have happened. So it is important for us to get into the habit of, first of all, performing regular hand hygiene, which unfortunately one cannot say is a routine practice amongst doctors in general and amongst general practitioners and family doctors in particular. So we have to get into this habit of making sure that every time we examine a patient, afterwards we perform hand hygiene, ideally using an alcohol hand rub, which is very effective even against the Ebola virus. The second point is that if we have a patient with fever, a patient who is coughing, a patient who has signs of infection, then if there are any body fluids, we have to wear gloves. and we have to tell the patients, listen, this is part and parcel of the way we examine patients. Because if you look at the British guidelines, when you have cases of Ebola initially, because initially the viral load is extremely low, and it increases as the disease progresses. So initially, simple measures, such as using gloves, performing hand hygiene, if the patient is coughing, wearing a visor, those are sufficient in order to prevent infection. So if we get into the habit of doing this regularly, and now some people will say, oh, but the patients will look at me rather strangely, if I'm wearing, if not a visor, at least a goggles, because the key is to ensure your hands are clean and to protect your mucosa, because that is where the infection is transmitted. It's not transmitted normally through unbroken skin. But if you do have a case that fits the case definition, then it's very clear. Minimize your exposure, and call public health on the number on the screen. Because we have a protocol available, which is tried and trusted. We've reviewed it, it works, and then public health will contact you immediately. They will guide you on what you do. Ideally, we keep the patient segregated from the other patients, and then public health will come together with possibly casualty, the outreach of casualty, and this patient, if indeed it is a positive case, will then be transferred to hospital.
And how can the general practitioner help with regards to contact tracing in that case?
In that case, then public health will come into the picture. Once the patient has been moved to the hospital, they will contact the doctor, they will contact the family contacts, the social contacts, and they will do a thorough contact tracing of anyone who has come into contact with this patient. As I said, most of these contacts would be incidental contacts. They would be very low-risk contacts, which are unlikely to be of major concern. But still, they are followed up. Every contact is followed up. If it is a high-risk contact, it's one thing. If it is a low-risk contact, there is another way of managing those contacts.
Doctor, we're nearing the end of our show. What particular message do you want to convey to our audience here today?
I think there are two messages. First of all, we need to keep this into perspective. This is a serious situation. It's a serious global emergency. There is nothing to downplay this. This is very serious, but it's primarily serious for, unfortunately, these countries where these outbreaks have happened. In the case of Europe, in the case of the Western world, there is the possibility, so no one is saying that this cannot happen, but that possibility is low. We have to be aware, we have to be on our guard, but most importantly, we have to practice those standard precautions that I mentioned. And you do this not for a patient who you suspect for Ebola, but you do it for every patient that you examine, that you see, that you manage within your clinics. Because if you have this habit, this system of adopting these universal precautions, these standard precautions, and they're nothing special. They're hand hygiene. They are avoiding the patient from coughing directly in your face. Speaking to a patient who has a respiratory infection or who is coughing from a tangent, so that if he coughs, he doesn't cough directly at you, but he coughs away from you. These are small tips. Wearing an apron, wearing gloves if you come into contact with body fluids. These are very simple precautions, but they are very effective precautions. And if we practice them, then I don't think we have anything to worry about in this and other infectious disease situations.
Thank you, Doctor, for your time and the information you've conveyed with us today. That's it for now. More information, more videos on TheSynapse.net, bringing content that matters to the busy medical professional.